I want to welcome everyone and our guest today on our second podcast called On the Frontline. COVID-19 has turned our lives and society upside down. We're living in surreal times, and whilst everyone across the world is being affected, none more so than frontline key workers. And today, our conversation brings three key workers to share their stories. To introduce them, we have Florika. Florika, just wave your hand. So Florika is a hospital doctor based in northwest London and working in Luton. She was working in ITU when the pandemic first started and has now moved to working in the maternity ward. She's due to start her physician training from August, and when she gets time off, she enjoys cooking and fitness. We also have Tushar. Tushar is an entrepreneur in social care. Just give us a wave, Tushar.
Right.
He operates 2 care homes and a domiciliary care service for the last 14 years, with a growing team recognized for its innovation in care and being one of the very first services in the UK to be rated outstanding by the care regulator. So, Tushar, in your spare time, you obviously live in Reading with your wife and 2 kids and enjoy photography, running and reading, and from what I've seen, some family exercise as well. And finally, we've got Bansri. Give us a wave. So Bansri is an ophthalmology resident based in Nottingham and is also currently doing a master's in medical leadership. She's been involved in a medical advisory capacity for a charity called Sevade, which is a voluntary grassroots organization that is helping the needy, and particularly during these times at NHS with the crisis. In her spare time, she enjoys long walks in the countryside, and you'll have to give her some good routes during this conversation, and is a vegan baker as well. So again, roots and recipes from you. So today we're going to have a conversation about personal stories on the front line. And I think I just want to start with Florika. So with the medical profession, most people understand it through medical dramas or fly-on-the-wall documentaries, but actually we don't see the overwhelming workload and stress, and particularly in intensive care. And you were obviously at the height of the pandemic when it first hit us, you were working in intensive care. So just tell us a bit more about what ITU is and what your daily routine is.
So intensive care is a place where patients will go when they're unable to support their own bodies. So if anyone needs any form of life support, and that can be specific organ support, so if they need help with their breathing, we can put them on a machine that helps with that. If they need help with their kidneys, we can help filter them. So different parts of the body that needs extra support, and a lot of our patients are put to sleep to receive the extra support because they're often exhausted of trying to support themselves. So my daily routine actually changed a lot over this transition into the crisis period. So initially I would go onto the wards in the morning. We would examine our patients, find out about our investigations, what's happened, what's changed with the patient's status, and see what else we can do to help them. A lot of that would involve family discussions as well. Since the crisis started, I think our roles changed in many ways. I think the biggest way is with the PPE. As a doctor, especially in intensive care, things are changing from moment to moment. There's a lot of monitoring that we have for our patients. And as soon as the monitor goes off, your instinct is to run to that patient immediately and do what you can to solve the situation. But with the changing times, actually, you hear that monitor and your first thought has to change from run to the patient to run to quickly put on my PPE. And I don't know if anyone has experience in PPE, wearing PPE, but it's never just a 2-second job. It can take anything from a minute to 5 minutes, depending on how much you need to be protected against what that patient has. And in the COVID wards, it's often a 5-minute process. So trying to override our own reflexes with ITU has been definitely quite a challenge.
Yeah. And you're at the brunt of the crisis because you're seeing distress, suffering, and death. Has there been a particular moment or time that you can share where you've just found it particularly difficult working in ITU?
Yeah, definitely. I think for me, it was the first time I actually realized the scale of this pandemic, and that it came to our hospital. It was the first time I really became overwhelmed. I'm quite a calm and collected character. I'd like to say I don't get overwhelmed very easily. But I remember leaving work on the Friday with maybe one suspected case to coming back on the Monday, unable to enter my ward because there were huge infection control measures everywhere. So a whole new back passage into my ward was created so that there was a separate place for us to dress into our PPE. I remember looking at some of the reports, so radiology reports, and looking at the x-ray pictures and looking at the blood results for our patients before I went to the ward that day, and just seeing so many patients with x-rays that looked exactly the same in a very, very bad way, back to back, was absolutely overwhelming. I've never seen anything like it in my career. So, every now and again, we'll see a bad image, or we'll see some bad blood tests, but you wouldn't be in a situation where you'd see, for example, 6 in a row that look equally overwhelming, and there's not much you can do about it. And for me, that's the hardest part, is we're working at a time where everything is new. So we're treating and trying to gather information on what's working at the same time. And we've been quite fortunate in modern medicine that most things are already figured out. So being in a situation as a doctor and you're inclined to help and know what to do, to all of a sudden being overwhelmed in a situation where you're surrounded by so many patients, where you're so limited in how you can help them other than encouraging them to support themselves, for me has been the biggest challenge that I've had to face.
And Bansri, you're in ophthalmology, which is probably not as frontline seeing COVID patients per se, but your job has also been impacted by this, hasn't it?
Yes, so many of the junior ophthalmologists have been redeployed to medicine, but ophthalmology as a whole has changed dramatically. So all our elective activity, all our regular clinics and surgeries have been completely cancelled. And we're only really providing emergency care that's face-to-face. Even the provision of that care has evolved. So face-to-face consultations are really the last step. But in between, there's triaging patients over the phone, perhaps imaging them, and then lastly seeing them face-to-face. And there's been loads of other changes that the COVID crisis has sort of been a catalyst for across the department. So the patients we would see on a regular basis every month or every couple of months, we're now having telephone calls or teleconsultations with them. I think some of those changes are here to stay.
It's really interesting because even in primary care, face-to-face is the last option, and it's just made us realize and accelerate our use of technology in seeing patients. Tushar, you work in the care sector, social care, and it's something which we don't ordinarily, especially during these times, hear so much about in the news. And definitely a lot of the statistics around morbidity and mortality have been mainly based in the hospital. How has social care been uniquely impacted by this crisis?
Yeah, I mean, it's been a double-edged sword. And I say double-edged sword because what you see in the media is the unforgotten deaths within care homes. So we saw last week that care homes were not registered, deaths of care homes, people with COVID were not being registered in the national statistics. Also, some of the resources such as PPE, testing was not being made available to people working in the care sector. So there was lots of challenges. And I think in a way it's created a lot of frustration and a lot of, why are we forgetting the people, the vulnerable people that we've been looking after? And I think that created a lot of frustration. But at the same time, and I call it a double-edged sword, I see the positive of this, because social care has always been the understudy. It's sort of like the second child to healthcare. The healthcare has been the golden one. The politicians always talk about it. You look at the last election, yes, it was a Brexit one, but NHS played a big part of it. But we never really addressed the social care challenges that society is facing. But what really is very heartwarming is how people just overcome these challenges. And I've seen so many great stories of people coming in and living, the staff moving into the care home with their residents so that they're fully protected. I'm seeing so much collaboration between care providers, supporting each other, sharing information, sharing suppliers so that they can get PPE. And it's really created a camaraderie across the sector, which is really helping us navigate these uncertain times. And I think if we can carry on with this, I think this is really going to create a much more beneficial society. And I think not only just within the social care sector, I think the healthcare sector has also recognized the role. So we're seeing much more collaboration with NHSs, the NHS outpatients, GPs. Everybody's now working together in a much more cohesive way, which I think is the positive, and hopefully long may it last.
Yeah, that's really inspiring to hear that there are carers that are willing to stay with the patients. How have you managed to keep the morale of your staff so high?
Yeah, I mean, we have two care homes, and obviously one of them is a specialist dementia home. So as we know, people with dementia, they really have no understanding of what's happening in society in the day-to-day life. So when you're looking at social distancing, etc., it's not going to be something that they're going to comprehend. So the staff actually came forward 4 weeks ago, but even before the lockdown, said we need to lock the care home down and we want to move in. And when they first said that, my heart was full of compassion, pride, and warmth, thinking, wow, that's amazing. They're prepared to sacrifice that. In my mind, I was thinking, oh my God, how are we going to make sure they're safe? What about the mental health issues? What if, there's all these challenges? But actually, it's been amazing. And somebody in the local community actually documented it and done a short video. And when you look at it, it really is heartwarming. And we're seeing this across care homes across the country, where the staff have put their own needs ahead of their residents. And I think that's the one unique quality that I find in care workers, is that they're always prepared to give, and they're always giving. And sometimes that burns them out. So I think, from our perspective, we're there to support them. We're constantly in touch with them, giving them good positive feedback and recognition, just being there for them. But actually, I think the positive is that, like with everything, they've actually come together and they love it. And I was just speaking to the manager today, and she goes, she loves it. They don't want to move out of the home once even this whole crisis calms down, because they love it so much. They've actually bonded as a family with the residents. And you just see the photos, the Sunday lunches, the sing-alongs. It's just heartwarming, and long may it last.
Wow. I mean, just hearing you, I can really sense that it's really kind of hit you in your heart as well. Like, this is something which rarely you don't hear these sorts of stories, and they need to be shared. Times of adversity bring people together. And I suppose, Florika, like, how is it within the hospital setting, especially within ITU? Like, we hear stories of doctors and nurses at the bedside wearing the masks all day up until there's marks on their face, and not even having time to go and go to the loo or go and have a bite to eat. Like, how do you keep yourselves motivated?
Definitely, it's definitely true. And actually, the nurses I feel very sorry for, especially the ITU, because they have to be by the patient's bedside for their entire shift, and if not there, someone else needs to be there because it's such an unpredictable environment. And you are exhausted, you're very sweaty, you're very tired, you're very warm, and you're left with bruises on your marks on your face from where the mask has marked you. But at the end of the day, I think everyone's grateful that we're at least lucky enough to be in that situation when we can do that. But there's certainly a notion of, I don't want to waste PPE, I need to go to the loo, but if I just wait half an hour or an hour more, then my shift will end, and that way I won't be wasting or under-resourced. So people are always, just like Tushar was saying, trying to put others before themselves, and they're very conscious of the environment. But I think morale is always kept very high. So I'm quite fortunate that in our hospital, they've set up a whole well-being hub, and they've really got a lot of focus on that. So we have people from the community who donate lots of different food and drinks. Staff bring in their own food, drinks, bakes. And if you get 5 minutes in your day, you can go there, grab something, listen to some music. There's even people there to talk to. And it makes such a difference to your day. And one really lovely thing that I've started to see around the hospital is children are writing thank you letters and drawing pictures for us, and they've been displayed absolutely everywhere, you know, from the toilet to your ward, the corridors, anywhere you think of it. And when you're having a really bad day and you just look up maybe when you're changing and you see that, it fills you with a sense of pride and a sense of purpose, and it does keep you going. It gives you goosebumps actually, because you know that people are actually grateful for what you're doing, and you do have something very important to do, and it gives you that push that you need when you're having those low moments. So yeah.
And Bansri, how about in your workplace? Is there that level of support and the motivation among staff?
Yeah, very much so. I mean, things have changed dramatically. So we've gone to having, you know, daily team meetings with the whole of the department, you know, senior members, junior members, and that's really lovely. Like seeing everybody and having the opportunity to talk or to discuss the challenges that you've got coming up. The other really great thing is I was on call last week, and we were doing 12-hour shifts, and the on-calls have become much busier because local opticians are shut, so the emergencies are coming directly to us. And because we're down in the number of doctors as well because of redeployment, often you're the only one around, and you're seeing, you know, like twice as many, 3 times as many patients. And you know, just the small conversations that you have with the staff. You know, one of the nurses like asked me what I was listening to and what my favorite song was, and I really couldn't remember, you know, the last time I'd had like a normal non-COVID conversation. And it's things like that you remember that people are human, and it's our connection, it's our conversations that keep us smiling and light up our day.
Yeah, it feels like such a paradox that now more and more we're using technology to stay in touch, but it's actually the small things, human touch, which make a world of difference, especially on the front line. Bansri, apart from being an ophthalmologist, you're also working for a charity called Seva and Youth for Seva. Do you want to just explain what they are and perhaps what role civic society plays in this crisis?
Yes, sure. So Youth for Seva is a summer internship program. So it's a platform for young people to challenge themselves and get out of their comfort zone and start thinking a little bit differently about the roles and the responsibilities that they have within society. And the idea of the program is that they're encouraged to spend 6 weeks working out in the grassroots level with NGOs in India. And they come back very inspired, very motivated to engage in giving back within our local communities here in the UK. Leading on from that, Seva is an initiative which encourages people to do just that. So give back to their local communities here in the UK. And during the COVID crisis, it's been fantastic. You know, the communities really come together. Like in the first few weeks just before the lockdown, they launched their first campaign related to COVID, which was Help a Neighbour campaign. And within the first few weeks, they had up to 2,000 people sign up to volunteer, do various different things. So it might be cook food and deliver the food to vulnerable people, or they've been delivering cooked meals to key workers. Like Florika mentioned, the ITU staff who've been doing 12-hour shifts. They've been helping do shopping for vulnerable people and deliver medicines between pharmacies and patients. At the moment, with the national shortage of PPE, Sevade have done a fantastic job in procuring quite a large amount of PPE, and they're even working with local manufacturers to make gowns and make masks and provide them to CCGs where there's a shortage, or care homes, which is a shortage. So it's been really lovely to see all sorts of people from all walks of life come together and really step up. And I know, again, just, receiving a call for somebody who's alone, or getting a cooked meal at the end of your shift, or even a chocolate or a coffee, it really makes such a big difference to how your day goes, or how you feel.
Yeah, I mean, it's these informal forms of care which do so much more to keep people motivated, and I suppose support the entire NHS engine. Just briefly explain what Seva is, because that's both in Sevade and Youth for Seva, that's a word that comes up. So just briefly explain what that means.
So Seva, for me personally, and in the context that it's used in both Youth for Seva and Sevade, is an evolved understanding of how you see yourself and your relationship with the world around you. So it's basically around a mindset change, the way that you interact with this world around you. So that's from, lifestyle choices to like being vegetarian, being vegan, acts of kindness, acts of service, giving, gratitude, taking responsibility. So Seva is a small term that encompasses essentially a way of living and interacting with the world around you. Okay,
amazing. And I hope we can inculcate that same mindset and that feeling within all of us, not just for now and for the future as well. Just going back to Florika, so I just want to touch on an issue which I think we all face, which is stress, and how we cope with stress. So can you share, in the last few weeks, any moments where you were particularly stressed, like you were just wishing that this week would just end, and how do you cope with
it? So I think going back to the beginning, and I think the time where I think I was one of the most stressed was when I realized how bad this pandemic was. I mean, our ITU that week expanded from 1 ward to 4 wards across the hospital, with plans to expand even more. We were retraining staff in different departments, in different areas. And like I said before, it was that feeling of being helpless, even though my entire life I've been trained to help. And also the fact that when patients are so unwell, they can't have their family and friends by their bedside because of infection risk. So that week, I think I felt it the most. And I feel like I'm quite fortunate. I've got a lot of friends and family around me who are there for me all the time. And my biggest outlet is probably my mum. So every day on my way back from work, I always ring her and tell her what's happened in my day. And that day, for the first time, I don't know how long, I cried on the phone on my way back home, because I was just so overwhelmed. I'd never seen anything like it. It's almost something that you read about, or now we know there's many films about, but you never expect to be living yourself, or be in that situation where people expect help from you, but you're unable to give as much as you normally can. So I'm quite lucky in that respect. My husband's also quite good, so he's not a medic, but he helps me in other ways. So he's become the housewife in some aspects. So that's been really nice, just coming home and he's done a little bit for me. So a little bit of the cooking maybe, or something around the house. Like Bansri was saying, those small things that make a difference. Or he's bought my favorite chocolate, or he's got a cup of tea for me ready. Those kind of things really make a difference to your day. So he's definitely taken a different role during this time, but it's been nice, yeah.
So for those that don't know, I was actually flatmates with Kishan back at university, and let's just say that his role in the kitchen was pretty minimal, to a point where he couldn't work out the difference between olive oil and lime cordial. So we had an interesting episode. So has his cooking improved in the last 10 years?
It doesn't surprise me at all whatsoever. If only you knew all the stories about his domestics whilst in our first year of marriage. But he's definitely come a long way. And I can officially say, if you want a pizza from scratch, including the base, he's the man to go to.
Really?
But it starts
I was just, earlier on, I was mentioning that I love moong dal. Like, that is one of my favorite dishes. And this weekend, I invite all of you. We can get on another call together, and you can help me make some moong dal burgers. How about that? Sound tasty?
If you're going to train my husband, definitely tuning in for that.
And Bansri, you know, you're a vegan baker in your spare time, but during this particular period, what sorts of things have you been doing to sort of just come back home to and relax?
Well, I have been baking. So I baked some cakes, took them to work, dropped them off for my grandparents. And actually, so what I did just before the lockdown was I scanned some Gujarati books in on my phone, and I gave my dada the hard copy. And as I moved out of home, because unfortunately I can't live with my grandparents as I usually do and still work in a hospital. So as I moved out, I have now got into this habit of Zoom calling my dada, who's like never used Zoom before the lockdown ever. I read in Gujarati, and he spends like half an hour correcting me. So yeah, it's really great. It's a lovely way to stay connected. You know, connect back to my roots, and also keep in touch with my grandparents, who I've always almost taken for granted, like seeing them every day and living with them, as I've done it for the entirety of my life. So actually, it's a massive personal challenge not living with them and not seeing them. And I know many key workers are in the same situation where, you know, they can't go home to their loved ones because of the risk of making them sick. It's such a paradox, you know, staying away from your loved ones is what's protecting them.
Okay, just launched the
awful, Rajiv. It's like GCSE Gujarati books. So today we read like My Trip to Zurich. It's great. But Tusharji, I know you said you were looking for books. I'm happy to send you my scanned Gujarati books.
Thank you very much.
I don't want to do any online readings. It's like horrendous. But you know, it's a lot of fun, and my Gujarati's come a long way just in the last 4 weeks. I've gone from like literally starting with a G book again to like reading about Zurich and planes and airports. So yeah, I highly recommend it, especially to keep in touch with, you know, your grandparents, and there's so much to learn from that generation, which this is the perfect time to touch base with them and maximize the opportunity that we've got to gain, you know, all that we can.
Yeah. And Tushar, you're a family man. You've got a wife and 2 kids, and school's been out for the last 2 weeks as well. And it's back on now. How have you managed running a few businesses, doing all the extra work that you do outside that charitable work, and also keeping a family active and happy?
I think you might need to ask them that, whether they're happy or not. But I think, you know, the blessing of this whole crisis is really allowing you to focus on what is really important. I think sometimes when you're busy being busy, you think that you have to travel this much to have a meeting, or you need to be somewhere. And actually, the reality is technology is fantastic. It allows us to connect and have much more meaningful conversations without the stress. And I think the one thing, and even speaking to my team and other people, I think people feel more relaxed and more productive in this crisis because they're not having to go through the daily commutes. They're actually having to eat more healthier. That 1 hour of exercise is something that people really value, whereas before it was, well, I'll just wait, I'll exercise till tomorrow. So I think in a way we've actually begun to with the right approach and the mindset, you actually begin to appreciate that you can do just as much, if not more, in the current climate. And it's been great. I mean, still working, still doing crazy things. So kids say, Barry will always, her biggest bugbear is I'm on a Zoom conference nearly every night at the moment. But at the same time, we're having some real quality time with family and friends. And I think one of the things I was just sharing the other day was the bank holiday actually felt like a bank holiday because you weren't having to rush off to meet friends and family. You weren't going to the shops. You just were at home for 4 days and you really unwound and spent quality time as a family and just be. And I think that is something that I think when this all comes to an end, that hopefully people realize that actually not doing anything is actually a productive thing as well. And it can also allow more deeper and meaningful connections.
Yeah, it's a strange paradox that now myself as well, I'm away from my family and we stay in touch even more than maybe if I was living with them, because somebody will be out and we'd never have dinner together, and now we're sort of on Zoom, we're all having dinner together, and it's a nice feeling. I think it's definitely brought families together as well. Do you think after this is over, and nobody knows when it's going to be over, how do you think, I suppose, our lives and society and maybe the NHS and social care system is going to change after this is all over?
Yeah, I think that's a $64 million question that everybody's now asking. What does the modern world look like this? We're seeing things, are we in a recession? Are we in a depression? To be honest, I'd like to look at it as, I think there's going to be an economic reset. And I think this is going to give an opportunity. And it's going to give us an opportunity to really look at what is a society, community, family life we want to be living in. And I think if, we've seen some great collaboration between healthcare, social care, just generally within our communities. I mean, the other day, I picked up 30 face masks, the visors, which were made by somebody that had a 3D printer in the community. So I think people have really come together and there's been a real sense of community, which I think we'd lost over the last 15 years, just the way society moved, where we became very self-centered, maybe focusing on our immediate needs, looking what we call the rat race. And I think people are realizing actually there is something magical about being a community, having that sense of serving others and not giving without expecting. So I do really think there's going to be some important, if we approach it as a society in the right way, there can be some real massive opportunities. And I think there's going to be some tough decisions to be made. What do we value as a society? How much are we going to be spending on services? Because I think what we realize is a lot of the things that we thought we needed are actually not necessary. I mean, a prime example would be my daily Costa or latte. Do I really, really need it? Can I use that to help somebody pay for somebody's education in a country where education isn't so prevalent? So I think there's going to be a massive, from this reflection, hopefully, it will create a chain reaction that helps us transform society. The risk is that we don't do that and we just end up going back to the way we were, and all the magic that's happened and that we all look at is lost and in history books when we reflect back. And I think we've got a real opportunity, and I hope that not just the politicians, but everyone in society says, right, how can we make our society a better place to be?
Yeah. It's interesting because the last election was completely fought on Brexit. And going back to what we value in society, things like the healthcare service, things like an aging population, the housing crisis, it's a real opportunity for us to reflect on exactly what you said, which is what do we value in society and what do we care about as a country as well. Any thoughts from, I mean, Bansri and Florika, in terms of how do you think maybe your own workplace or the healthcare system, but just generally society around, how is that going to change?
Well, I think within the NHS, there's definitely going to be, significant lasting impact. And the challenge is going to be which one of those systems are here to stay going forward, which ones are we going to let go of? One of the challenges is going to be how do we deal with the backlog of patients that has been created because of the lockdown. The increase in morbidity. Perhaps patients aren't seeking help as much as they ought to because they're so worried. And in a system that's been largely underfunded and understaffed, how do we now deal with this surge in demand that's definitely going to come in the next couple of months as the lockdown's lifted? But the positives are really that, people clapping for the NHS and for carers and key workers. I think people are starting to appreciate what professions, what people are doing, what key workers are doing, be they cleaners or supermarket staff. And I think our focus has shifted into appreciating the work that they do. And I hope that that's here to stay, and that's reflected in the way that we fund that work, and also in the future the way that we vote.
Yeah, that's interesting. Florika, any thoughts?
I think I definitely agree with that. I think one of the things I really hope is here to stay is that sense of community and that sense of pride that we have from, like she was saying, something as small as helping your neighbor. I hope that we continue to notice the vulnerable people around us and continue to help each other. We were stronger for it, and appreciate everyone's roles within society and how we all have a part to play in building a safe environment for us to live in. In terms of the NHS, I agree there's a problem with the backlog, but there's also some very interesting things, like you were saying, with technology. Even GPs, Rajiv, you must know that there's a lot of telephone consultations, video consultations, and then as a last resort coming to a face-to-face. And I wonder if in a population where we're having a lot more patients with chronic disease, a lot more aging population, if that's the way forward, triaging, because I'm sure you're getting a consultation now done in a couple of minutes that might have taken 10-15 minutes, plus the frustration of the patient having to wait there the entire time. So it'll be interesting to see how the healthcare system changes in the future.
Absolutely. Go on, Tushar, you had something?
Yeah, no, I was going to ask him a question. So what would you say were the top 3 things you would like to see change within your roles or within your organizations post-COVID?
So for me, in my management role over the last year, there have been some real struggles to deliver change, and just in the period of the COVID crisis, there's been so much change and so much evolution. I think it's been great to see how dynamic our system is and how adaptable we are. So for me, I'd absolutely love to see that stay, where resources are needed, to put them in and to proactively develop the system in a way that's dynamic and adaptable. For me, like, if the NHS has shown that we can do that, and if we continue to do that, I think continue to evolve, that's a massive game changer.
Yeah, good.
I think in primary care, I think one of the things that personally I've always been apprehensive about is telephone consultation, video consultations, because I've always been an advocate of face-to-face, and you get a sense of how the patient is. But I think through this, I've become a lot more comfortable in having those video tele consults, and I think that's probably going to pick up, and definitely it's going to reduce the demand of especially primary care. And I think the second thing is just the interface between primary, secondary and community care. I think that's been one of the things which the NHS has been debating for decades, and they come out with all these acronyms on how to solve it. But I think this is one real opportunity for us to think about integrated care as well. Yeah. I think, Florika, what you said about these kind of small acts of kindness that everybody is doing right now, and we've all felt that, whether it's a carer saying, I'm willing to stay with a patient, or whether it's someone from Sevade delivering food to hospitals or PPE, or it's just a child drawing something wonderful for hospital doctors to see. One of the things, just wanted to relate back to this term that Bansri, you've talked about, which is seva, this community spirit, this selfless acts of kindness. It's something that, it's strange that we all feel the benefits of that, and definitely during a struggle we feel the benefits of that. How do you think we can make sure that that sustains, regardless of any maybe organizational changes, but that feeling, that mindset, how can we keep that alive?
Oh, it's a very interesting question. It's a very, very difficult question to answer. I think that so far we've been living in a generation that's been very fortunate. I think things have come to us very easy. We've never really seen the hardship or the struggles that the generation above us or the above that they've seen. People have seen wars. A lot of us have had parents or grandparents that have come to this country with not much at all and built them up. And actually we've been quite lucky to live in the generation where the hard work of our families are paying off, and we're not seeing how things came to light and how things evolved. It's the first time we're seeing it. So I'm hoping that light alone will be enough for people to think twice before they're rude after they've been waiting 2 hours to see their doctor, or because there's been a long line at the supermarket, because they've had those, I don't know how long, couple of months to think about how much they need every single person around them. And I'm sure at one point during the situation, they felt vulnerable. They might not have been a key worker, but they might have been absolutely frightened that they met someone who had a cough and they might have it. And remembering the acts of kindness that they received and how much a difference they might have made to someone else, I hope that will help people sustain kindness in the future.
Okay.
Absolutely. I think one of the beauties of human connection is that once your paradigm is shifted, it's quite difficult to go back. People might forget a little, but kids will never forget having their parents at home so much, and having so much time with them, and baking together and doing the garden together. And like Florika said, it's those smaller acts of kindness that are keeping us going now are difficult to forget. So that feeling that you get when you give selflessly, or you connect, meaningfully with others, those can't be erased. And I think therefore they're here to stay. And anything that makes you feel good will naturally flourish. And I think because helping each other, being kind, being grateful, all of that is so naturally sustainable. I hope that we'll see it grow.
Yeah, I think this is a once in a lifetime opportunity. I think a lot of companies have really looked at, whether they call it pro bono work or corporate social responsibility, they've almost put the jargon behind it. And I think the COVID has really made it a reality for society. And, we hear about flattening the curve, every day in the government briefing. But I think what COVID has done is flatten society in terms of status, because COVID, regardless of how wealthy you are, what profession you are, where you live, it doesn't discriminate based on that. It impacts everybody in the same way. And I think what this has made us all realize is that we are Mother Nature doesn't discriminate based upon wealth, status, education. But what it does also, same time, has done is created a sense of community, of seva, of helping each other, and these small acts of kindness. And I think the opportunity for us as a society is to really ingrain that within our businesses, within our educational environment, within our communities, and really make that part of our DNA. Because what we've seen is people do things which have really brought an extraordinary smile. I mean, Thursday at 8 o'clock, when you walk out of your door and you hear those people clapping, their children banging on their saucepans, it brings a sense of pride and appreciation, but it also makes it worthwhile when you're doing those 12-hour shifts, when you are really faced with some tough situations. And I recall just last week, one of our carers, her mum passed away from COVID, and she only took a week off, and she's back at work doing a 40-hour shift, if not more. And that sense of dedication and commitment is what we need to be valuing as a society, not people's bank balances. And I think that's something that I think this will really give us a time to really make a reality for, if we use this opportunity.
Well, I think that's a great one to end on. Actually, that's some salient points that you've made. That COVID, even though it's been as devastating as perhaps a world war, what it's done is it's brought us together rather than divide us. And let's all hope that that community spirit of acting kindly towards one another continues. It's been an absolute pleasure to have all three of you on the call today and discussing your personal lives, some really personal stories of working in the front line. I hope you enjoyed it, and hopefully sometime in the near future we'll all be able to meet up, enjoy some vegan baking from Bansri as well, and we'll definitely organize something. So thank you guys for joining, and stay safe, stay well.
Thank you.
Thank you.
Thank you.
Looking forward